Hello, everyone, and thank you for joining us. Jan, thank you very much for setting aside your time for everyone, and I truly look forward to an exciting conversation. We will be speaking about acne. This is acne in general, as well as any specific questions you have around acne, adult female acne, etc. A quick concept, though, of what you can do with the products and what we'll be discussing. This is an individual baseline to 6 months using technologies that will be discussed today. Again, looking at all skin types and all forms and presentations of acne. Here's another individual. You can see the hyperpigmentation associated with acne, and we can discuss a little bit about how you're clearing acne as well as clearing the discoloration secondary to it. So I just want to introduce Jan. She's on the line right now. Jan, I will be passing it over to you in just a moment. Jan founded Jan Marini Skin Research 26 years ago, almost to the day, as this is our 26-year anniversary. I am proud to have worked for this company for nearly 10 years now. I'm our VP of Marketing and Clinical Development. The company that you created is a truly impressive one, from company to products and solutions, and as a knowledge source. And for all of you on the call, I'm sure you will come to recognize this as well as a source of knowledge in this industry. And for the products and everything, Jan is truly a inspirational individual, and very, very proud of this. We were surprised and honored by an award just given this past end of 2019 by New Beauty magazine. They recognized the top 20 innovators in the aesthetic space, and this is for all of time. And Jan was one of the top 20 innovators named through the country for their impact in the greater aesthetic space. So Jan, congratulations on that. To everyone, again, please enter your questions into the chat. We'll attempt to get to everything. And Jan, I will stop sharing here and I pass it to you.
Hello, it is such a pleasure to be here. And I've been very excited about this, so thank you so much for participating today. I want to make sure that you understand that I'd like this to be participatory. I really want you to please feel free to speak up and ask questions. Now, there's going to be a question and answer period, and you can put your questions in the chat box, and Stuart will help me navigate that. But you can also unmute at the appropriate time if you want to elaborate on a question or ask a question. So please feel free to speak up. I want it to be interactive. I'm going to start off and give you a little bit of information on my background, and from there I'm going to go into the acne process and some of the causative issues having to do with acne. So I've been a product researcher now for well over 40 years, and back in the early days, my expertise was in the area of ingredients. You know, when you pick up a skincare product and that list of ingredients, it oftentimes is complicated and it is mysterious. And how do you know if something is really going to have an effect on your fine lines and wrinkles? Is it really going to make your acne better? Is it going to make it worse? And I did a lot of lecturing to medical professionals, physicians, skincare professionals. And then I started doing a lot of radio and television because it lends itself really well to talk shows, and people want to know what is it that they can buy and how do they spend their money and what works and what doesn't work. Now, as time went on, I began to develop associations with physicians and researchers literally all over the world. And I started to really focus on uncovering and identifying breakthrough technologies. Now, I'm going to qualify the word breakthrough because in today's marketplace, anytime you see a new product, isn't it always referred to as a breakthrough? Well, when I say breakthrough, I'm talking about things that really weren't in the marketplace. And I'll give you an example. I began researching glycolic acid as an early glycolic acid pioneer back in the early to mid 80s. And you couldn't walk into a department store, you couldn't walk into a drugstore and buy glycolic acid. It didn't exist commercially. Now you could get it for cleaning stains off your driveway and grease out of car engines. And around 1989 going into 1990, I actually financed and brought to market 2 product lines. I'm going back a long way, you may or may not remember these, MD Formulations and MD Forte. And it was unique for a couple of reasons. It was the first real commercial glycolic acid line, but I made a decision that these products were going to be marketed strictly through physician offices. And I have to tell you, this is my fourth business, and that was the most challenging time I've ever had in a career because physicians didn't dispense products out of their office. And they were just so offended at the very idea that someone would suggest that. And of course, today everybody does. And the other thing that was unique about it, it was the first time that a pharmaceutical company, and in this case, the pharmaceutical giant Allergan, purchased a skincare company in the professional market. And then in 1994, founded Marini Skin Research. And as Stuart said, our anniversary was actually on July 1st. So on July 1st, 1994, I took down the MD formulation sign and put up the Marini Skin Research sign, and here we are today. And you know, whenever I talk to the media, I always can predict at least two questions that I'm going to get asked. And one is, do I use my own products? Absolutely. I always think that's kind of silly. And the second one is, what is it that motivates me? Why do I read all the medical journals and do the research and development? And I give the same answer every single time. I'm selfish. I don't want to have adult acne, which is what we're going to be talking about today. I don't want rosacea. I don't want discoloration. Hopefully I'd like to keep fine lines and wrinkles away as long as possible. I'd like to have relatively glowing, younger looking skin as long as possible. I don't believe that I am different from anyone else. I always say, I don't need another product. I want a solution. And that's what we're going to talk about today. We're going to talk about solutions specifically focused on acne. And you know, acne is an epidemic today among women in their 20s, 30s, 40s, and beyond. It is something that really affects an individual's self-esteem. And I hear all the time people say to me, well, Jan, I had acne as a teenager. It got better. And then when I was in my 20s or 30s or 40s, it came back again and it was different. It was actually worse. Or my acne never really went away, but it changed. And now it's on my chin, it's on my jawline, it's perioral, and I get these nodules and I get these cysts. Acne is a term that is used to describe a process. Now, you can have one acne lesion, you can have an acne lesion once a day, once a week, maybe you don't get one for 6 months, but it's the same process. It's all considered acne. It's a matter of whether you have more chronic acne or mild acne or severe acne. And acne is not about whether or not you have oily skin. You can have very, very oily skin and not have any acne. You can have dry skin and have a lot of acne. And it's not an infection. It is an inflammatory process. And it's also known as retention hyperkeratosis. Now, I'm going to show you a follicle drawing of a normal follicle. Now, at the top it says surface of the skin. So when you touch your skin, you're touching what's called the stratum corneum. And the stratum corneum is a dead layer. You shed about 500 million cells a day. You're not aware of this. They're microscopic cells, so you're constantly shedding. When you look into a follicle opening, we commonly refer to them as pores, but you look into the follicle opening, you're looking into a long hollow tube about as big around as the diameter of a hair. And inside of that tube, there are cells, just like on the surface of the skin. Constantly, you're shedding cells into the follicle. At the bottom, you have the sebaceous gland. Now, one of the reasons you produce oil is because oil pushes those cells to the surface. They sit there and they fall off. That's the normal process. That's what's supposed to happen. Now, if I can go to the next drawing, this is where the beginning of the acne process. In acne, and we don't know why, it's probably hereditary, but we haven't discovered the acne gene. Now, it's an inflammatory disorder, and we have discovered the inflammatory gene. It runs in families. That's why we think it's hereditary, but you could be the only person in your family with it or the only person in your family with it. But what happens is these cells start to stick together. This is known as a microcomedone. You're not aware of this process. Your skin could look perfect on the surface. It's microscopic. And these microcomedones can flare up, or they can be sitting dormant for days, weeks, months, even years at a time. I'll give you an example. The average age at which females develop hips in the US is around 8 years old. And the onset of puberty is not marked by menstruation, it's marked by breast development. So you could have a little 9-year-old girl as an example, and getting budding breasts, and she could be in puberty, but her skin could be completely clear. And then maybe on her 11th or 12th birthday, she wakes up and suddenly she's breaking out. So the process has probably been going on for a considerable amount of time. Now, acne can progress in several directions. So in this next drawing, this is the mildest form of acne. And believe it or not, if you have a blackhead, a clogged follicle, that is a very mild form of acne. So what happens is the cells are sticking together, and pretty soon your follicle dilates. You see that as an open comedone, oftentimes referred to as a blackhead or a clogged pore. And again, very mild form of acne. And you can squeeze them or have them extracted. You can get something out of the opening, but you have done nothing to interrupt the process. So the frustrating thing is, it's just in a matter of a very short period of time, everything pushes itself right back up to the surface. Now, in more severe acne, next drawing, you can see how the follicle is kind of closed off, but inside the follicle, you have dead cells that are sticking together. And in this follicle, it traps oil. So you've got dead cells and oil. And it also traps P. acne bacteria. Now, P. acne bacteria is harmless. You can have very clear skin and have colonies of P. acne bacteria. And it's not infectious. You can't catch it. You can't spread it. It's just a part of your bacterial condition. So when it's in the follicle, though, when it's trapped with the dead cells and the oil, there's virtually no oxygen. P. acne bacteria thrives when there's no oxygen. And what it does is it eats the oil that's trapped in the follicle. And then it excretes a fatty acid byproduct. Now, this byproduct is inflammatory, it's corrosive. If everything stayed in your follicle, you'd never break out. But what happens is you can have a leak, a rupture, or a blowout. So the follicle wall opens and some of the material goes outside, the dead cells and the bacteria, and it creates an inflammatory process. If you have a leak near the top of your follicle, you'll probably end up with a papule or a red bump, nothing too serious. If you have more of a rupture in the middle of the follicle, more material goes to the outside, it's deeper, you're probably going to have a nodule or a mini cyst. And those lesions may or may not scar. Now, let me describe what I mean by a scar. A scar is an actual loss of tissue. A scar is where there is some type of an ice pick scar, a divot, a compromised area of the skin. There's a depression. Post-inflammatory hyperpigmentation or discoloration is not a scar. We can get rid of that. Sometimes it takes time. And you can also have a scar that also has post-inflammatory hyperpigmentation, but they're two different things. Now, when you literally have the entire side of the follicle blow up, that's typically what occurs in severe cystic acne. And the inflammation hits down into the dermis. As it makes its way to the surface, it destroys collagen and elastin. This is why severe cystic acne virtually always scars. So there's several things that you have to do if you're going to have complete total clearing. Now, again, first I want to mention there's no cure for acne. Even Accutane is not a cure for acne. What Accutane does is it puts people in remission. Remission could be a year, could be 6 months, it could be 5 years, it could be 10 years, or it could be partial clearing, not total clearing. I'm sure that you know people, I'm sure those of you on the call know people that may have been on Accutane more than once. I'm a 2-time Accutane failure, and my skin is completely clear. So you have to do these things every single day. So number one, you need to introduce something in the follicle that interrupts the process of the cells sticking together. Okay, that's number one. The good news about that is the same topical agents that we use for that also resurface the skin. So they also dissolve and dislodge the glue-like substance or cellular cement in between cells on the surface of the skin as well. And that means your pores look smaller. It means your skin looks smoother, it looks really refined, it looks glowing. It helps with the appearance of fine lines. It even makes discoloration if you have actual brown discoloration from sun exposure, etc., makes your skin look brighter and more uniform. Okay, second thing you've got to do is you have to introduce something in the follicle that goes after P. acne bacteria. If everything stays in the follicle, if you don't have bacteria or the P. acne bacteria that's feeding on the oil and excreting the fatty acid byproduct, the follicle doesn't rupture. But you cannot kill P. acne bacteria permanently. If you could, that would be called bactericidal. But again, it's just part of your natural makeup. So we have to have something called bacteriostatic, meaning that we can keep those colonies down. We can keep them down to virtually almost zero by doing something every single day. So we've got to introduce something in there that keeps that P. acne bacteria at a level where it's not going to create a problem. And third, anti-inflammatories, because acne is an inflammatory disorder. And so when you put this together, done in the right manner, then you are able to not only address acne, but you can address aging and make your skin look younger, look smoother, make the texture look better. You can even help to some extent with the appearance of acne scarring. Okay, so what is it that we can do? So number one, and it starts off with what we call our skincare management system. And this is a skincare management system. Now, I'm not going to go into a lot of details on the entire system, but the system is going to address the issue with having cells that stick together in the follicle. It also helps with that whole inflammatory issue. It also makes the skin look much smoother, younger. When you talk about acne scarring, you talk about all the issues that go along with acne. It helps to address that significantly. And I will discuss one of the products in the system. One is something called BioClear. And just to give you an example of how this can help address this issue, BioClear is a combination of glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for rosacea, sold by prescription for acne. It also is one of the best resurfacing agents we've seen for the appearance of follicle size and the appearance of fine lines, and just making the skin look more uniform and making it look brighter. Secondly, glycolic acid. Now, if you took all the ingredients, literally cosmetic ingredients in the world today, all of them, there are two that have been studied more than any other medically. And when I say medically, I mean histological studies, biopsies, I mean actual medical studies. And one are the retinoids, and the other one is glycolic acid. So at the most simple level, glycolic acid dissolves and dislodges the glue-like substance or cellular cement between cells. And it causes them to lift off the surface, to lift apart, but in the follicle, it keeps them from sticking together. So it helps to interrupt the acne process. But we also know glycolic acid has been shown in medical studies to stimulate significant collagen. So over time, it can help with the appearance of acne scarring. It helps the skin to look more uniform. It helps with the texture of the skin. And I could go on and talk about ichthyosis and talk about psoriasis and all kinds of things, because this truly, if there is such a thing as a miracle ingredient, it really is. And then we have salicylic acid, and we've heard of salicylic acid, and we know that that's also very helpful for acne and for helping to keep the original comedone from forming. So when you put those three together, I have never seen anything for home care that addresses the appearance of aging, at the same time has a significant benefit for assisting with clearing acne. So that's one side of it. That's whenever I do consultations, and I do lots and lots of consultations with celebrities, I do consultations with physicians, people that own some of the biggest companies in the world, and every single time, I don't care how sophisticated they are, they can afford to spend money on the most sophisticated products and services in the world. It all starts right here with the system. So that's number one. Number two, duality. And duality is an incredibly important key to being able to clear acne. So duality is actually a product that has two chambers in it. Chamber number one is benzoyl peroxide. Now I know what you're gonna say. You're gonna say, Jan, benzoyl peroxide is a teenage medication and it's just gonna dry my skin out. Well, in this case, it's not, but let me explain first how benzoyl peroxide works. Benzoyl forces peroxide in the follicle where it releases oxygen. What did I say? P. acne bacteria can't live in oxygen. It kills better than anything we have ever seen. And that's a statement by the American Academy of Dermatology. It's the most effective antibacterial agent ever invented. If it works for you once, it'll work for you forever if it's in the right percentage. Now, what is unique about this benzoyl peroxide is when you go over the counter, or even if you have a prescription benzoyl peroxide, it's all micronized, but it's micronized to about 60 microns. This is actually micronized to 5 microns, so it penetrates quicker, it doesn't dry the surface of the skin, and it works faster. Now, how do we know this? Well, for one thing, we actually did a study in Canada that was conducted by Dr. Jaggi Rao. He's a board-certified dermatologist in Canada and in the US, and he also heads up the dermatology residency program for University of Alberta, and he's the founder and CEO of the Acne Clinics of Canada. He probably treats more acne than any other doctor in Canada. And we conducted the study in weather that was over 20 degrees below zero. The patient's skin was actually more hydrated at the end of the study. The individuals in the study, their skin was more hydrated after than before. So this is really a revolutionary technology. Now, you have to use this every single night. If you miss a night, and if I were to miss a night, then what I can tell you is that it might not be the next day or the day after. It could be, but within a short period of time, I'm going to have a flare-up. So this is a preventative. When you get to the end of the process, when you see a lesion, that's the end of the process. You want to prevent the breakout. You want to have complete total clearing. Now, the other chamber that's in here, and this is where it also gets really is a game changer, because this is something that we struggle with as adults. Again, how do I address my acne? How do I also address my aging? Well, number one, the system. But secondly, this chamber has retinol in it. Retinol is a gold standard for addressing acne, but it's also a gold standard the world over for addressing aging. And I could spend a lot of time going into retinol in terms of how it thickens the dermis up to twice as much and thins and compacts the stratum corneum, because we want a nice, thin, compact, beautiful stratum corneum and a nice, thick dermis. But in addition, we have something in here that gets rid of discoloration up to 300 times faster. So that post-inflammatory hyperpigmentation. We also have anti-inflammatories in here. We also have something that helps to block some of that hormonal issue that's a definite component in adult acne. And again, maybe in your questions we can get into it a little bit more, but it has to do with the enzymes in your follicle getting together with the testosterone sensitivity to low-free testosterone and creating dihydrotestosterone. And that's where you get that acne that's chin area, perioral, and along the jawline. So again, skincare management, duality. You can dramatically change the appearance of your skin, not just in getting complete total clearing and controlling your acne, but also texture and just the appearance of fine lines and wrinkles and all the things that we associate with sun exposure, etc. Okay, so I'm going to stop here. And Stuart, are there any questions in the chat box?
Yes. So Jan, we've got a host of questions, and I think you've actually touched on a number of them already, but I'll go through a few of them. So one question here was related to benzoyl peroxide versus salicylic acid.
Mm-hmm.
And you spoke to controlling acne to prevent it from coming versus treating it after you have the lesion. So the question is, what is best and how do you look at those two different ingredients for controlling acne?
Okay, you use them together. What salicylic acid does, and by the way, it's your smallest molecule of any of the acids is glycolic. It has a molecular weight, I think, about of 1, and salicylic is somewhere up there about 9 or 12 or 13. But salicylic helps to also kind of break down the original comedone. You have to go after both, and it doesn't have the same anti-aging benefits, and it doesn't have the same benefits in the follicle to the extent that glycolic does in terms of keeping the cells from sticking together. It's helpful. It's very helpful. When you put the three together, they're very synergetic. But benzoyl peroxide, you must have that component for the P. acne bacteria. So it's a combination of all of that. one of the questions that came up, and by the way, thank you so much for the questions that you gave in advance. And this came up a couple of times. What products do you recommend for women that are pregnant or lactating? So let me preface my answer by saying that I always tell our technical support department, if you get a call from somebody that says, can I use such and such when I'm pregnant? If they said, can you use water? We say, ask your doctor. So it's always something that your doctor has to approve. But in general, what I will tell you is, if you look at the physician's desk reference, if you look at any information having to do with benzoyl peroxide, it states that it is safe in pregnancy and for nursing mothers. Retinol is going to be up to the discretion of your physician. There are OBGYNs, there are pediatricians out there that have their patients using retinol. Other physicians are more conservative. So it's going to be up to your doctor, but you can use, and again, you have to get your doctor's approval, but it is indicated that you can use benzoyl peroxide.
I've got one here that I think would be
yes.
It's come up a couple of times, and it was one of the initial ones. So the two questions, one is to hyperpigmentation, and especially in treatment of acne on skin of color. The other one is a question around acne scarring. And can you take a moment to describe scarring versus the redness versus the hyperpigmentation and how those address with different skin types as well?
Okay.
And I'll stop
When you have an inflammatory process, and what happens when you have this process going down, when the follicle opens up and you have this material going outside and it creates an inflammatory process, that inflammation, and it has to do with blood leakage and different things under the skin, but that inflammation creates bilirubin and bilirubin. This is this discoloration. It shows up different on different skin types. If you're really fair, it may show up as being just very red. If you have more of an olive or darker skin type, it can be brownish, it can be purplish. And so these iron oxides can stay in the skin. And eventually they fade, but it can take a long time. Glycolic helps with that much more rapidly. Using BioClear, the 3 acids, helps much more rapidly. But also we have something in duality that has been shown to get rid of that about 300 times faster. So if you had seen these same individuals, you're looking at photos, and I don't know if that's about, Stuart, if that's about 12 weeks out. But
yeah, I'll just pull those up really fast again.
The longer that you continue to clear the skin, the better and better this discoloration gets. Now, the other thing that I want to mention.
So this is, baseline to 6 months is the total clear. And we do have hers at 3 months, and it's almost completely clear. But
I can tell you it's going to get better and better and better, because you've created inflammation. You've done things to the skin over a period of time, and it takes a while to clear it. And it's going to be different grades of acne, different levels of severity, et cetera. Now, with acne scarring, generally, when you have a scar, you have compromised the skin, you have actually, you've done something that compromises the collagen. When you use substances that have been shown to stimulate collagen, and retinoids in particular, glycolic, azelaic, salicylic, etc., when you use these substances in the skin, what it does is that it stimulates more collagen production. And when you stimulate collagen production, it decreases the appearance of scarring. Now, it depends on the depth of scarring, so you can make it look better. Now, also, if you were to go to your provider and have glycolic acid peels, and that's something where literally you might have maybe a momentary, very little bit of redness, but you can put makeup on. It not only helps to clear the skin faster, but also, because it's even a higher percentage, it helps to hopefully stimulate some of that collagen production. There are also things that you can do in the aesthetic industry in terms of lasers and things like that. And some of the lasers are not ablative lasers. They actually work on stimulating collagen, and so causing the skin to kind of fill in. So there are a number of things you can do. You can also do ablative procedures. It depends on the depth and it depends on the severity. So hopefully that answers that. Anything else up there, Stuart?
Yes, so there's another couple here that I think 2 or 3 can be joined together in one question. So there's a little bit asking what order would you apply these if you're talking about the system? And similarly, somebody asking the question, well, if you're using an AHA and you're using the retinoid, and how can you do that without irritation? So can you speak a little bit to the study that you mentioned the study and for reference, that was using the skincare management system with duality. And as somebody who grew up in Minnesota, -20 is crazy dry. Your legs, your shins split on their own.
So
but
first
you can talk about putting those together. Yeah.
Okay. So first of all, I'm going to tell you, in December, I'm going to be 69 years old. So when people get to be in that age range, one of the things they're always concerned about is dry skin. Now, I wouldn't say that my skin is particularly dry. And let me just kind of backtrack for a second. And again, if you want to look really close, no acne. It's completely clear, and I'm not dry and I'm not scaly. In fact, my skin always appears to be pretty soft and dewy. So first of all, it's not just about saying, well, gee, I'll go out to the drugstore and buy a glycolic acid product. Glycolic acid, in order to have the effects that I'm talking about, has to be at a certain pH. For home care, it's right around 3.25. And so there's very, very strict formulary conditions to be able to get these effects. And that's why I'm very specific about what you use. In the system, and I can't remember, is there another part to that question, Stuart?
It was the use of multiple ingredients together, but also what order to use them.
Okay, so there's actually 5 products in the system, and it's really a cleanser, which is a glycolic acid cleanser, and a sunscreen, and 3 products in between. BioClear is product number 3, and you also have some hydration, and there's very specific technologies in all of these. Between BioClear and between your hydrator, we call that 3.5. That's where we put accelerators. Accelerators are things that more fully address a particular concern. So it could be duality. It could be something for actual brown hyperpigmentation. It could be retinoids, stanaloid retinoids. It could be things for volumizing the skin. There's all kinds of things that we can do to take people to a higher level of skin rejuvenation. But it goes in between those 2 products, and you can pretty much layer just about anything in there. So hopefully that answers your question.
Very much so. Thank you.
There was a question about Milia. So Milia is where you get these little white bumps, and they look like they're right near the surface, and you just want to squeeze them, and nothing comes out. What Milia is not acne. It's a cornification of the sweat duct. So your sweat duct are designed to constantly expel salts and various things, you know, when you sweat, etc. And when that sweat duct becomes compromised, and the tendency toward it can be either hereditary, but it can be exacerbated by sun exposure, then what happens is you form these little deposits. And yes, they need to be extracted. Now, will they come back? Well, sometimes, yes, they will come back. But what you can do to help to prevent them from coming back is to use things that the acids, etc., that can make a big difference in helping to maintain the clearance of the sweat duct. So hopefully that answers it. And there was another question in here. It had to do with diet, and it had to do with teenage skin and diet.
That's what I was just going to ask.
Okay, perfect. So, and this really is not just teenagers, this is anybody. You know, we used to say, with regard to diet, we kind of really didn't have enough information on that, and we used to really just say that it didn't really matter. And I know a lot of parents would love to tell their teenagers, well, you can't have fried food and you can't have greasy food, and of course that's not a great thing to have in your diet, but it's not going to be a causative factor. Interestingly enough, there was a study published in the American Academy of Dermatology. It was done on 57,000 nurses. Excuse me, it was reported on the sons and daughters of the nurses, and then there were 2 separate studies, 3,000 teenage girls and 3,000 teenage boys. So this is conclusive. One of the causative factors of acne is milk and dairy. Now, you're going to say, oh yeah, that makes sense because we give cows hormones. That's not why it's a causative factor. It's a causative factor because whether you buy your milk from Whole Foods or whether you just go to the grocery store, in the US and pretty much around the world, to keep the herds up, they milk cows when they're pregnant. In the wild, if a cow is pregnant, it pushes the calf away. It stops allowing the cow to nurse. Because what happens is it starts to produce certain steroidal hormones. And you can take, again, get your milk anywhere you want. You can get it tested, and there's quite a large number of steroidal hormones in milk. And so in those individuals that are sensitive, and it's a large number of the population, it can be a causative factor or exacerbate acne. Keep in mind, that's milk, that's yogurt, that's dairy. And the second thing that we do know has to do with the glycemic load. Now, the glycemic index is something that most of us are kind of familiar with. If you look at a Snicker bar and you see it's, you can just, you know right off the bat, it's going to have a high glycemic index because it's got a lot of sugar in it. But the glycemic load is what happens when you eat something, you're digesting it. How much sugar is it turned into? And to give you an example, you could take the best piece of whole wheat bread that you could possibly find that you think is the most natural and got the best nutrients in it, and take a quarter cup of sugar. Which one of those do you think is going to create the most sugar in your bloodstream? It's the bread. So the glycemic load plays a very definite role. Now, why is this? What happens is that when we have a high glycemic load, our blood sugar levels go up. And it may be temporary. Now, over years, sometimes it can actually create our blood sugars not being quite as low as it should be. And I don't necessarily mean you're going to get diabetes, but what happens when those blood sugar levels tend to go up is that the body produces, to take them back down, more testosterone. And this is a factor particularly in female adult acne. So again, it's a more complex issue having to do with the enzymes in the follicle that get together with the testosterone sensitivity or a little free testosterone, and they sort of shake hands and they create dihydrotestosterone. And again, it's usually it can be anywhere, but it's usually particularly located on the chin, jawline, and perioral. Okay, so
let me add one here, and it's a question here, but we also have started receiving this in general questions. So if somebody is doing sports and active and a lot of sweating, and I think this one is particularly of very recent news, exacerbated if you're wearing a mask a lot of the time. What do you recommend as to if somebody has acne and doing a lot of sports and perspiring hot, etc.?
Okay. Well, first thing, I'm gonna cover the mask acne for just a minute, and I'm gonna go back to the sports acne and remind me, Stuart, if I forget. But there is something that, first of all, if you have a tendency to acne, there's no cure for acne. So certain things that you may do, whether it's hormonal changes, whether it's diet changes, whether it's stress, whether it is wearing a mask, could exacerbate that tendency that you have, and it's acne, and you can still prevent it. I'm not like everybody else. I have to wear a mask a lot of the time, but I don't break out because I prevent that from taking place. Now, there's something that can happen secondarily, though, and this is something that's called fungal acne. Fungal acne, actually yeast, is a buildup of yeast in the follicle. And that's also what happens with dandruff. So with fungal acne, it can look exactly like acne, but sometimes it's itchy. And fungal acne needs to be treated a little bit differently. You have to use an antifungal on that. And typically what is recommended is something called like Nizoral, which is ketoconazole. It's Nizoral. You can get it over the counter. It's a shampoo. Or you can, if you need something stronger, you can go to the doctor, then give you something stronger. Another one would be Lotrimin. This yeast is known as I'm going to not say this right, Pityroporum or Malassezia. And it's just ordinary yeast. And so typically those things will get rid of it. But in general, when you're wearing a mask, it's all acne. Now, when it has to do with sports, it's exactly the same thing. Just because you're sweating doesn't necessarily mean that you're going to have more acne. It's when you do not treat it to begin with, it can be an aggravating factor. So if you're doing everything you can to prevent it, and by the way, we make a separate, this is a lot of times when we talk about a lot of sports and stuff, this could be an adult, but it's also teenagers. We make a separate 2.5% benzoyl peroxide wash and a separate 5% and 10% benzoyl peroxide. It's a matter of them washing with the benzoyl peroxide wash and also proactively treating that area, that whole area, with benzoyl peroxide. And by the way, this leads me to another comment. You know, people talk about spot treatment. When you use benzoyl peroxide, you use it everywhere where you normally break out. You don't know where your next lesion is going to be. It's a preventative. It's not a spot treatment. It's a preventative. Stuart, any other questions?
I was going to emphasize that one as a parent of a soon-to-be teen, the importance of preventative treatment and not waiting until lesions are visible. You know, for everyone thinking on that, looking back to those progression images that you showed of how the acne lesion forms, it's stopping it from getting to the end phase that is the important part. There's a question about cystic acne. Can you give a word or two toward that, or a couple of questions around that for cystic acne? And the other question that we've had a couple for is body acne, not just face, but back, etc.
Okay. So first of all, cystic acne, the more severe form of acne, again, it looks like the whole side of the follicle blew up, and the inflammation goes down as deep as the dermis, which is why it almost always has scarring. You treat it the same way. Now, with that said, in some cases, we go to benzoyl peroxide twice a day. For most of the time for adults, that's not necessarily. Teenage acne is a little different, and if we were talking about teenage acne, teenagers, we're not concerned with fine lines and wrinkles. We can hopefully prevent fine lines and wrinkles by because most of the damage you're going to see in your lifetime happened before the age of 10, at least 50% before the age of 20. It just takes 20, 30 years to show up. So teenage acne we treat a little differently in that it's a focus on benzoyl peroxide, typically starting off at night, oftentimes going to day and night, a benzoyl peroxide wash and a sunscreen that actually can absorb oil. Okay, so that would be really important. So for cystic acne, you treat it just like you would any other acne. Now, there are some exotic forms of acne. There's acne congoblata, acne fulminans, and that's a whole different animal, and it requires typically, no matter what you do, you've got to go on Accutane, and Accutane can be a real miracle for a lot of people. Point taken that it is not a cure. So as soon as people get off of Accutane, we get them onto a program that keeps the follicle clear. In terms of body acne, again, it's really not any different. A benzoyl peroxide wash, making certain that if it's acne on the back, that somebody can apply benzoyl peroxide to the area on the back. Now, one thing I will say about benzoyl peroxide, in all the years that I've worked with it, I've never had this happen with me. But it can bleach out clothing. So you want to make certain if you're using this at night that you put on a t-shirt or a cami or something so that it's not going to bleach out your sheets and your pillowcases, etc. Okay. And I had a question about how to treat if the patient is allergic or sensitive to BPO. Okay, if there's an out and out allergic reaction, in other words, you're having hives, you're having swelling, you're having a lot of contact dermatitis, itching, you have been diagnosed with an allergy, then you can't use benzoyl peroxide. If you're saying you're sensitive, that's a different issue. It could be an issue of acclimation, or it could be the fact that you've not used this form of benzoyl peroxide. Because again, the benzoyl peroxide you're going to get commercially is very different. And so I haven't really ever worked with anyone, unless there's an allergic reaction, that can't acclimate. Sometimes we have to start somebody slower, but that's unusual. Doesn't usually happen that way. So virtually anyone can use benzoyl peroxide. You have any other questions up there, Stuart?
Yes, there are two other questions that I see right now, and if anybody else has questions, please feel free to type them in.
Yeah, and if you want to unmute and elaborate or ask me something, please feel free to do that as well.
Yes, especially if you want to raise your hand, we should be able to find you and unmute if you wish to do that. The question here, final two that I've seen, one is and you spoke to this a little bit, but for acne scarring and that discoloration, does it go away on its own? And the other one is, and this is a different topic, but just to name the two, is acne rosacea. So
okay.
Acne associated with
okay.
rosacea.
Sure.
By contrast.
Okay. So first of all, discoloration, yes, it can go away on its own, but the darker skin types, sometimes it just lingers around for a very, very, very long period of time. And you oftentimes need some type of intervention to assist with that. And duality can assist with that. But also beyond that, if it's something that's really, really severe, there are lasers, there are other types of things in the aesthetic industry that can also assist that. Peels can assist with that. Your provider can assist with oftentimes having that be alleviating it sooner. Now, acne rosacea, that's kind of an old term. It used to be called acne rosacea. Acne is one disorder and rosacea is a disorder. And rosacea is an actual skin disease. You can have rosacea and acne at the same time. Typically, rosacea affects the kind of this sort of upper 2/3 of the face. It can also affect the scalp, the neck, the chest, but generally it's in this area. And what's confusing is you can have secondary lesions with rosacea. They can look just like acne. But they're a little bit more transient. Sometimes you go to bed with rosacea lesions on your cheeks and then you wake up in the next morning and they might be a lot better or almost gone. So getting a little bit technical, the difference between a rosacea lesion and an acne lesion is that a rosacea lesion does not have a microcomedo. It's strictly inflammatory causes, and there's no P. acne bacteria. It's not bacterial, it's strictly inflammatory. So with rosacea, it's a disease of vasomotor instability. Your blood vessels are designed to expand and contract, expand and contract. In rosacea, that's compromised. And it has to do with an inflammatory protein that you produce. Now, this protein is really good because if you wound yourself, it's a protein that helps in the healing process. But when you're producing it for no reason at all, and it could be because you had spicy food, or you're sitting in a stuffy room, or you had coffee or chocolate or any number of things that are your triggers, it can cause this to flare up. Rosacea is a disease of reactivity, not sensitivity. It's what you're reactive to. Now, many of the things that we use, that we've been talking about today, also are used in the medical community for rosacea. In addition, we have a product called Rosalieve. And we have a lot of data on Rosalieve, and it has been shown to dramatically help with the appearance of the redness and the factors associated with rosacea. So, any other questions, Stuart?
There's one last question here that I've seen, and this is relating to a fun product that was just launched earlier this year. Would you recommend the multi-acid resurfacing pads for acne? And if so, how would you use them and how often would you? And are there any masks that you would recommend?
Okay. So here's generally the hierarchy. If you talk to people about acne, the first thing they want to do is they just want to get clearing. And when you get clearing, then you start to say, okay, what about my follicle size? And what about if there's acne scarring? And what about if there's discoloration and all these other things? So there's so many things we can do to take it further and further and further and further in terms of skin rejuvenation. And when I say skin rejuvenation, I'm not talking about just fine lines and wrinkles. I'm talking about, in resurfacing, I'm talking about how the skin looks overall, whether it's rosacea, whether it's acne, acne scarring, discoloration, all those common skin concerns. So one of the things that you can do to add into your program, and this is a fairly new product, and I didn't plan this ahead of time, I just happen to have these things sitting on my desk. But this is the multi-acid resurfacing pads, and what this is, it's a jar. There's 30 pre-soaked pads in here. There's 4 different acids. They work at different levels in the skin. Now, I'll tell you why I love this. Because it's instant gratification. And you don't always get instant gratification. So what you do is you clean your face, your glycolic acid cleanser, and dry it and everything, and you wipe the pad over the face, and you leave it on for about 10 minutes, and then you just rinse it, and you put the rest of your products on. And you see something right away. You notice that the skin just looks smoother. It just has more of a glow. It looks more refined. And if you have acne, if you have rosacea, if you have, whether it's the fine lines, whether it's discoloration, it also can significantly help to address the appearance of those issues. And as you use it over time, it gets progressively better and better. How often can you use it? Well, part of that depends on the time of the year, typically 2 to 3 times a week. In the summertime, your skin's a little more forgiving. In the wintertime, it's a little less forgiving, but in general, 2 to 3 times per week. And it's used right along with the other products. And these are the kinds of things that can actually help to decrease the appearance of some of the issues that go along with acne, again, discoloration, scarring, those kinds of things. One of the things I want to mention, glycolic acid chemically is actually characterized as a moisturizer. And one of the things that it does is, besides the other things, the attributes that I've talked about, is that it stimulates certain substances in the skin that give the skin volume and hydration. So again, that helps to disguise the appearance of some of these compromised areas. And these are substances like mucopolysaccharides and ceramides and phospholipids, hyaluronic acid. You've heard of hyaluronic acid. So that's why I can address my acne, keep complete total clearing, and at the same time, my skin looks very soft and smooth and hydrated. So these are, there's a lot of different add-ons that you can do to take your skin further and further in terms of skin rejuvenation. So hopefully that answers that question.
Yes, and actually you just tipped into a question that posted, as you mentioned, hyaluronic acids and keeping the skin hydrated. There's a question here. Can you use Hyla 3D as a hydrator in conjunction with the system or duality? Okay,
absolutely, you can use Hyla 3D. Now, what you do is you want, again, acne is a really important issue, and it's a complex disorder, and it's actually can be treated fairly simply, but it's not about picking and choosing. So it starts off with the system. So if you're using the system and you're using duality, can you add Hyla 3D in? Absolutely, you can add in virtually any one of the other technologies, anything, and you can add as many. So Hyla 3D, again, would go on after BioClear. It goes in that 3.5 window. And what this does, it doesn't replace the regular hydrator, but what this does is, this goes into the skin very, very rapidly, which is great. If you have an oily skin, you're not thinking, okay, I'm adding something to make my skin feel more oily. If you have a dry skin, it leaves a nice texture, but it goes in right away. And what these are very different than hyaluronic acid products that you see in the marketplace. These are tiny little molecules, and these little molecules go in much deeper. Just one of these molecules is 50 times more moisturizing, and at 24 hours it has 5 times more than if you just put hyaluronic acid in a normal product on the outside of the skin. And it's a lot more complex than that, and there's a lot more technology to that. But those are things that also can help with the appearance of giving the skin more volume, but also when it looks plumper, it decreases the appearance of things like acne scarring. Okay.
I was going to say, you could go into an almost full discussion on Hyla 3D and how that and hyaluronic acids in that product are bar none one of the most impressive hyaluronic acids out there. I have a question here. Michelle, let me find you here to unmute. There's somebody who'd like to ask you a live question. Give me 1 second.
Hello, can you hear me?
Yes, I can. There you are. Go ahead.
I can hear you. Yes.
Oh, perfect. Hey, so I have a question on your kit. Normally, there's certain ingredients that you shouldn't use together, like sometimes vitamin C or AHAs or retinols. However, in your kit, you formulated them to where you can use step 2, which is the siesta serum. Absolutely love that. And then you go with the BioClear, and then you can even go in with your retinol at night. So my question is, how did you do that without causing a lot of irritation on the skin? Because I know in other products I've tried to use like a vitamin C and a retinol, and it's a no-go.
So Michelle, it's kind of complex, but I'm going to try to simplify it as much as possible. What you're talking about when you're talking about vitamin C, it's very different than what we have. You're talking about ascorbic acid. In order for ascorbic acid to be effective in the original studies, which were by Dr. Meisner and Dr. Shininski, the original patents, is it has to be at a pH of 2.5 or lower. Now, what happens at that pH is about 50% of the population gets very irritated. And so when you increase the pH, you don't have the same effect that they had in the studies. But so it has to be at a pH of 2.5 or lower. And so what people oftentimes do, or companies do, in order to decrease the possibility of having even more irritations, they say, well, you can use your vitamin C at night, or use your, separate it out, your retinols and your vitamin C. So that's not because it's going to hurt you. It has to do with the irritation. What we work with is we work with something called lipid soluble C, or ascorbyl palmitate or chemically L-ascorbic acid 6 palmitate. It has a pH of over 6. And it does not irritate the skin. And there's actually studies that have been shown, anti-inflammatory studies, and shown on decreasing pustule count. So it also is completely stable. So you can use it right at the same time that you use these other things, and they can all be used together. So there is no medical reason or anything that would indicate why you can't use them together. And it's a matter of, again, this is something that, this is years and years and years. I've been a product researcher for 40 years. So it's about being able to put these things together in a way in which it truly is able to address these conditions without having those issues that oftentimes people are faced with. So hopefully that's helpful. Michelle, was that helpful?
It does. It did help a lot. I've used your kit and I absolutely loved it. It changed my skin. And I was always wondering, I'm like, how am I able to use a vitamin C and a retinol and my skin looks better and it doesn't look irritated?
Well, thank you, because that's one of the things that it does. Even people that have rosacea, this is an anti-inflammatory, and it really can make a difference. And I don't have time to go into it. I wish I did, because I'd love to talk about it further. But if I took the vitamin C out, it would still be an extraordinary product, something having to do with called DMAE or dimethylaminoethanol, because it actually causes the skin to kind of look more lifted and contoured, and that's a whole other story. So it's really an extraordinary product for a lot of reasons. And I thought I saw something come up in the chat box just then, Stuart.
Yes, there was two questions related to each other. One is, you'd mentioned a sunscreen that has oil control. Is there a particular sunscreen? And we now have 3 sunscreens.
I know, we just added one.
I know. And so is there something that you would choose or recommend, or what guidance would you provide to someone on that? And then the last really quick one, if somebody's using Hyla 3D and Duality, does the order matter? Where would you put those? Okay,
well, real quick, Hyla 3D, I would recommend that you put that one on right after your Duality, or excuse me, I'm sorry, your BioClear. Put that one on, and then everything else can go over the top. Other than that, there's really no order. Okay, sunscreen. So we have 3 sunscreens, and it's really a matter of preference, and I'll go through them very, very quickly. So, you know, when I say matter of preference, everybody has their favorites. My all-time favorite are SPF 33 Antioxidant Daily Face Protectant. I'm in love with the feel. And all of these sunscreens have what is known as a selective oil capture system. I'll tell you what that means. If you've got areas of your face, well, let's just say your face is entirely oily. Or let's just say you have combination oil, or maybe you just have an oily nose, or certain times of the year you're more oily, you go someplace where it's humid. It has the ability to pick up the oil, capture the oil, but it cannot capture water, and it cannot capture actives, and it can deposit and select at the same time. So if you're dry, if your combination, if you have areas of your face where you're very dry, it leaves you feeling soft, it leaves you feeling silky, it leaves you feeling very hydrated. So that happens to be my favorite. A lot of people, their absolute all-time favorite is our SPF 45. The SPF 45 is what is known as a physical block, and that doesn't mean it's better, I promise you, but it has a tint in it, and a lot of people like that as a makeup, because it gives you an extra polish, a little extra cover, and they just when their skin starts to really look perfected, and they feel like, and by the way, I'm not wearing foundation right now, but a lot of people like that as just a little bit of color, or as a foundation. Now, one word of caution I'm going to have for you, and I always joke with people, so if you use that, are you putting it all over your face, over your ears, on your neck, and your chest? So keep in mind, if you're wearing it like a foundation, you still need to protect other areas. With that in mind, we have a third product that is very much like the SPF 45, similar to it in that it's a physical screen. However, it has absolutely no color. So if you want a physical screen, if you're male and you don't want a little bit of a tint on the skin, and you also don't want to have to worry about maybe getting the tint on clothing or anything like that, that sunscreen is completely clear. It still has the oil capture system. All of these sunscreens also have a personality in terms of the kinds of ingredients that they have that are very, very beneficial and unique. And so, and all have the oil capture system. And I have to tell you, this sunscreen entry, this one that we just launched, in terms of having a physical screen, I will put it up against anything in the marketplace, because the problem you have when you don't have that tin in there is it looks white or it doesn't spread nicely. And this is the most sheer looking product. And it gives the skin, again, this really nice luminescence, but it still has all of that oil balancing property as well. So hopefully that kind of clears that up for you.
I think we're now a little over our anticipated time. As I'd mentioned at the very beginning, you are a wealth of knowledge and can speak to any of these points clearly at a drop of the hat.
I want to just say one thing before I go. I just want to say, first of all, it's been a real pleasure. You know that you can tell I like talking about this, but I thank you so much for joining in today. It's greatly appreciated, and I know certain I wouldn't be here if it weren't for people like you. So thank you so much. And Stuart, I'll turn it back to you, and I'm going to say goodbye, everybody.
All right. Thank you very much.
So much.
Thank you everyone for attending. As a reminder, do take a look at janmarini.com. Have a wonderful end of the day.